Hi everyone, my name is Barnett and I'm living with a spinal condition called Ankylosing Spondylitis. This condition is a condition that affects the spine, it affects the knees, basically all the joints in a person's body. I have been living with it since 2014. In 2014, I began having severe pains in my lower back, in my hips, in the knees, in the wrists, in all my joints and in other places. My mom began taking me to hospitals and private doctors just in order for us to find out what's really wrong with me and why I've been having so many pains. The doctors could not figure out what the problem was, so they gave me pain medications, Baralgene, paracetamol, Panadine, and some other more in order to help ease the pain a bit until they found out what was wrong. I began attending the University Hospital of the West Indies in order to start the clinic so that the rheumatology department can see if they find a reason for my illness, for the pains. In 2019, I was diagnosed with ankylosing spondylitis after undergoing a year worth of different tests. Jesus. I started the clinic and I underwent a series of tests in order for them to figure out what's wrong with me. After these tests, Dr. DeCooler, he diagnosed me with ankylosing spondylitis. Now, ankylosing spondylitis, when I researched and what I've heard from various doctors, is a very rare disease. This disease is found only in Asian men. And so doctors were so surprised as to how me, a young Jamaican woman, has this disease. Where did it come from? Nobody knows. And so in order to find a cure for it, they would have to do some deep research. After several different tests, after several different research methods, they found out that etanercept was a drug that could be administered to me in order for me to be treated. This disease has no cure, and so this etanercept is an injection when given once weekly will help to alleviate the pains, and it will help to give me a sense of normalcy in life since I will be living with this condition forever. Now, without this injection, generally, pains are extremely severe. I would wake up on mornings and I can't move. I have to take some pain medications and wait a few minutes or even an hour in order to begin moving my limbs. I can't walk properly. Even with these medications, moving about is extremely hard. It is very hard to even walk. When I walk for even 2 minutes, I have to take a step back, I have to stop, I have to wait a little in order to move on again because of how bad the pains are. And so what this injection will do, it will help alleviate the pains and it will help treat this specific disease.
Ankylosing spondylitis is a chronic autoimmune inflammatory disorder which predominantly affects the joints of the spine. It can also affect adjacent joints such as the hip, the shoulders, and the chest wall. Patients with ankylosing spondylitis, if left untreated, may go on to develop loss of function and fusion of bones. Some of them may present with humps in the spine, and if it is really severe, some have breathing difficulties. Unfortunately, ankylosing spondylitis tends to occur early in adulthood and therefore affects the lives of young persons. Ankylosing spondylitis can be treated, right? And we treat to prevent the suffering of the patient, that's the pain. We also treat to prevent the complications of the disease and the progression of it. And apart from the deformity and the disability that can occur, patients with this condition can have other organs affected, most commonly the eyes, but it can also affect the heart and the lungs. Treatment does not provide a cure, but it allows the patient to have quality of life and not to be disabled. The treatments available depend on the severity of the disease. For mild cases, physiotherapy and exercise with non-steroidal anti-inflammatories may be sufficient. But for most patients who have moderate to severe disease, they require biologic therapies. Biologic treatments are special injectable drugs that are able to dampen down the excess production of inflammatory chemicals in the blood, which lead to the symptoms of ankylosing spondylitis. In Jamaica, we have biologics in the form of TNF inhibitors, of which Enbrel, etanercept, is one. These drugs are pretty much essential for patients with this condition. However, the drawback is that they are very expensive. 1 month's supply of these medications costs between $250,000 to $300,000 per month, and therefore the cost is prohibitive, and most patients will require some form of support.
4 sets of injections, which will be administered once weekly. I started getting these injections on April of this year, and so it has been helping me tremendously. I can move about freely. Nobody even knows that I've been going through pains unless I tell them that without the injections, I can't walk. I look normal, I feel normal, I am so energized, as opposed to not being on the injection where the disease is slowly deteriorating my body. And so I'm asking for assistance in purchasing this injection because of how costly it is. It is very hard for me to purchase it since I will be continuing to live on it. The doctors recommended that I live on it for 2 years consistently in order to see the progress that it will make on my body. And then after that, I will have to live on it continuously for the rest of my years. Because of how costly it is, I'm asking kindly if you can support. I ask you please to do so. I have an NCB account. I also have a Sagicor account. There is also a crowdfunding website called realhelpinghands.com. I have a platform there where you can donate as well. If you search for Brian Barnett, my name will pop up, and my illness, my hospital letters, and all sorts of documents proving my diagnosis will be there in order to fuel you to donate. And so I ask kindly that you do donate. Linked in this video will be my account's information, and you can reach me also at the numbers 876-793-6760 or 876-392-2678. Thank you so much in advance for assisting me in whatever way you can. Linked in this video as well is a video of my injections and how it is administered weekly, along with a video from one of my doctors at the University Hospital explaining in brief what ankylosing spondylitis is. I want to thank all those who have assisted me thus far with securing dosages of my injection. Thanks to the Ministry of Health, who have paid for some dosages, which I have been taking since year. Thanks to Mendes, Duxes, and Garden Hill Estate churches, who also have helped. Thanks to everyone who assisted thus far, and thanks in advance to those who will see this video and will contribute as well. Thank you.